Okay, now regarding examination of the 9th cranial nerve and 10th cranial nerve, these nerves are usually examined together, both the glossopharyngeal nerve and the vagus nerve. The following step. First of all, I'll ask the patient about his deglutition swallowing. شلون بدك حماده؟ زين إن شاء الله. أكو عندك صوب والبلع شيء. Okay, if the patient had swallowing difficulty, this may indicate involvement of the vagus nerve, especially only when it is oropharyngeal dysphagia. And also I had listened to patient speech, whether it is dysphonic or dysarthric. After that, I'll assess the swallowing ability of the patient via drinking water or via an alternative test. Regarding the alternative test, just like this, السحم هذا بس ريدك تنفخ هيك حيل and to check whether the air is escaped from his nose or not, and to hear about it. هاي عشتي because patient who had affection of his palate due to vagal nerve damage, he hadn't the ability to perform this test, or I'll ask him to swallow water. We can provide him with water. هسه بس نريدك تشرب، راح نعطيك مي ونشوف بس البلع مالتك شلون تشرب. حاليا اشرب. شلون ابلعك هسه؟ كمل شربك. عشتدك. Really about just the swallowing test, some suggest it is advisable to use a spoonful, just 3 spoonful, and to test the ability of the patient, and after that to check whether the patient had cough or any change in his swallowing occur. Or this test would suggest that a large amount of water is to be given, and when the patient is swallowing, we have to disturb him by asking him about his or her swallowing, because the patient may make small chunks of fluid and keep it inside his mouth and then swallow it without any obvious evidence for this difficulty. Anyhow, this is the next step in the examination of the of both these nerves, and after that I'll ask the patient to open his mouth and to look at his uvula. افتح لنا حلقة قوي كلش. Okay, to see the inside of the mouth, and I'll ask the patient to say قول to see the uvula that is movable. عشتيدك بعد قول لنا. And to see the sides here. عشتيدك هاي هي على راحتك. After that, really, I would perform the gag reflex and then the sensation. Really, these tests, especially gag reflex, need permission from the examination committee. Most of the current textbook had omitted this test, but you have to check it, or to at least to take a permission to perform such a test. If we perform such a test, we have to warn the patient that we are going to perform such a test, because it is undesirable for many patients, and to see the response. The response will be just like the initial response of vomiting. The patient will have contraction, retraction in his mouth, contraction of the pharynx with the elevation of the uvula. Each side of the posterior pharyngeal wall should be checked. That's to say, I'll check the gag reflex initially at the left side, for example, then I'll check it at the right side, and to compare between them. But as I said, this test had been omitted in most of our clinical textbook. هسه حماده بس هذه راح اطخها بالعمق. اوكي ماكو مشكله. تفتح لنا حلقه. اوكي I'll lower the tongue. لا على راحتك. نزل. اوكي I'll test. Okay, just like this. I can't. I actually did. Okay, I'll omit the other, because this is just a demonstration. I'll omit the other side. Just like this movement, just like the initiation of vomiting is considered as positive, you have to check also the other side. After that, you have to check the sensation in the posterior pharyngeal wall. Also, you have to check each side and compare it with the other side. بس تفتح لنا حلقة بس اريدك تقول لها هاي تحس بيها ولا لا؟ تحس بيها؟ اوكي هسه هنا أنا تحس بيها عشتيتك. Okay, he had a sensation. These steps by which you can consider whether the patient had any defect in the in both this nerve or had defect in the vagal nerve, and the causes for this lesion of this cranial nerve. Also, the candidate should be carefully looked for this for the causes of this cranial nerve damage.